Hi, my name is Mafalda Oliveira. I'm a medical oncologist at the Vall University Hospital in Barcelona, and I am here at San Antonio Breast Cancer Conference, where I have presented the results of the phase 2 SERENA-2 trial. This is a randomized phase 2 trial testing different doses of Camizestrant, a novel oral selective ER degrader, versus the standard of care fulvestrant. So this trial included patients, post-menopausal patients with advanced ER-positive HER2-negative breast cancer that were candidates to receive fulvestrant as monotherapy, and randomized them to receive Camizestrant 75 milligrams, Camizestrant 150 milligrams, Camizestrant 300 milligrams, or fulvestrant. The randomization was stratified according to prior treatment with CDK4/6 inhibitors and the presence of lung or liver metastasis. And the primary endpoint of the trial was progression-free survival assessed by the investigator. The arm of Camizestrant 300 milligrams was discontinued because of a strategic reason without evidence of toxicity concerns. And SERENA-2 met its primary endpoint because Camizestrant at both 75 milligrams and 150 milligrams was superior to fulvestrant in terms of PFS. Hazard ratio for the 75 milligram comparison was 0.58, with a median PFS of 7.2 months with Camizestrant 75 compared to 3.7 months with fulvestrant. And the hazard ratio for the comparison of Camizestrant 150 to fulvestrant was 0.58, with a median PFS of 7.7 months compared to 3.7 months with fulvestrant. Camizestrant at both doses also showed a superior efficacy compared to fulvestrant in some important clinical groups of unmet clinical need, like patients progressing after CDK4/6 inhibitors, patients with lung or liver metastasis, patients with the presence of ESR1 mutations in ctDNA, and patients with evidence of ER-driven disease. It is interesting to note that Camizestrant at both doses reduced the variant allele frequency of ESR1 mutations in all these patients from cycle 2 day 1. And this reduction was not as apparent as with the arm of fulvestrant. Regarding tolerability, Camizestrant was generally well tolerated. Those reductions, those interruptions, and those discontinuations because of the adverse events were very infrequent in both Camizestrant arms. The most frequent adverse events were photopsia, sinus bradycardia, asthenia, arthralgia. Most of the adverse events were grade 1, and the grade 3 adverse events were infrequent in both treatment arms. So, in summary, SERENA-2 met its primary endpoint of increased benefit of Camizestrant at both doses with respect to the standard of care fulvestrant, with a very good toxicity profile. So, I believe that this can be a new option for patients with ER-positive metastatic breast cancer going forward. And currently, there are 2 trials enrolling with Camizestrant that are SERENA-4 and SERENA-6 that are testing the combination with CDK4/6 inhibitors in the first line. Thank you so much.